Hello and welcome to this week's What Were They Thinking? The first story comes courtesy of Elon Musk, who has made a comparison between chimps, humans and AI. The unfortunate aspect to this is that Elon Musk holds that AI is far more intelligent than humans can and ever will be, much as humans are and will probably continue to be much more intelligent than chimps. This statement was made at the World AI Conference in Shanghai. This continues the running narrative that AI is a viable prospective threat to humans. In other must-see news, SpaceX Starhopper has just passed its final hurdle. The Starhopper, as it is colloquially known, is an 18-meter tall rocket designed to propel small payloads a short distance and prove that its engine, the Raptor rocket engine, is capable in both form and function for repeated use. The hope for the ultimate product derived from this particular variant is that one day they are able to ferry goods and people far into space and then return. The Starhopper uses an engine that burns methane and oxygen. These Raptor rocket engines are used as a test prototype in this particular model. SpaceX hopes that in the future, larger test models, particularly the Mark 1, will use 3 Raptor engines conjunctively. The Mark 1 Starship will then be turned into the Starship. This is a far larger rocket that uses 40 Raptor engines. With the Starhopper prototype down, SpaceX can move on to the next stage itself, and, after approval from the FAA, should be well underway for production of test models. In a similar astronomical event, the ISS has been upgraded and now likely has better internet than anyone on Earth. A large capacity bandwidth is important to both communication and research on the ISS. This most recent upgrade has taken it to carrying 600 megabits per second. This doubles its previous capacity. Consider what this has required and what internet speeds you might be getting from your land-based provider. This was achieved by upgrading the infrastructure on the ISS itself, the ground-based services called the Space Network, and a number of satellites that are called the Tracking and Data Relay Satellites. Collectively, these improve the capacity of the ISS to transmit and receive. There were also software improvements made to the ISS system itself that has helped to facilitate this smoother movement of data. While in space, let's also consider the mysterious X-37B. It has now spent 719 days in space, and for those on the ground who are not in the know, specifically non-military personnel, we have no idea what it's doing or why. The X-37B is the 5th iteration of orbital test vehicles. These are highly classified, and little is known about it other than the following. It is a little bit smaller than NASA's previous space shuttles. It relies on solar power, and it will land using wheels. Officially, it exists to research reusable spacecraft technology. Finally, and perhaps most importantly, it was only ever expected to be in orbit for 270 days. It has more than doubled that lifespan. Coming back down to Earth, there's a strange werewolf syndrome appearing in Spanish infants. Fortunately for us, it's known both what is causing it and why it is occurring. It's tied into a lawsuit and civil case against the pharmaceutical manufacturer, pharmaceutical, as they had a role in the production and processing of a particular medication called omeprazole. It is used for infants with acid reflux. Unfortunately for the infants involved in this matter, the drug as it was shipped was contaminated with another drug called minoxidil. This is commonly used to treat hair loss and male pattern baldness. With a little bit of forethought and planning, you can probably figure out where this goes. The children are experiencing something known as hypertrichosis. It is a condition identified through the thicker, denser patterns of hair, coming from those areas that are usually not covered by dense, dark hair. In historical terms, those with it have often been diagnosed as having werewolf syndrome. Although we may now know what the medical cause for this condition is, the name has remained. Families of the 17 infants affected by this began action against the manufacturer after they were initially warned by the government agency to investigate what had happened and why. After a follow-up investigation found they had failed to rectify the issues, the factory was shut down and the company put on notice. The good news is that although the children are temporarily rather wild in appearance, they are unlikely to have any long-term effects. The extra denser hair growth will fall out, and the children will return to a more normal appearance. In another piece of pharmaceutical news, one very limited clinical trial has found that snorting powdered toad secretions may cause an improvement in mood for an extended period of time. This drug, with a rather long and difficult to pronounce name, happens to be produced in a number of places: plants, synthetic production methods, and in a number of toads. One in particular produces it in concentrations that have been investigated. The investigation used a number of people who were reporting various mood disorders. 42 participants were given the psychedelic drug. Of these, 24 of them were tested later. They found that of the 24 who reported back, they found an improvement in mood, life satisfaction, and being more mindful. Unfortunately for the researchers, they did find that they had a high attrition rate for this project. This means that those who did report back may have only been those who received a benefit of some kind. Those who had had a bad trip may have chosen not to report back at all. This leads to a selection bias. As with so many other drugs that are being explored, this one is a bioprospecting development that may or may not yet yield better results through either refinement or further investigation. Unlike bioprospecting and pharmaceutical development, vaccines are a well-established public health measure, and unfortunately, as has been seen over the last few months, America has set itself up for a measles epidemic by not vaccinating, and Texas may be on the cusp of being hit by the next outbreak. One group of researchers looking at Texas in particular used a modeling system that ran a simulation of a city moving as it normally would, people to work, to school, and then back to home. This then tracked the movement and possible spread of the disease. It is a well-established method of modeling pathogenic behavior and vectors of exposure, and has been described previously. In fact, this same methodology was used in California to help pass a bill preventing certain exemptions for school-aged children. In Texas, these exemptions may still exist, considering that in the last 16 years there has been a 28-fold increase in exceptions, from just over 2,000 to just over 64,000. The problem this massive increase to exceptions creates is that a small increase in non-vaccination leads to a huge increase in infection rates. To be specific, The concern in Texas is that a further decrease by 5% or more could lead to a 4,000 or more % increase in infections. Unfortunately for Texas, many schools and school districts are teetering on the lowest possible end of the herd immunity threshold. When this is passed over, the probability of widespread and significant infection rates increases dramatically, as will the harm, especially to children. As mentioned earlier, this sort of modeling has been used to remove exemptions. It has also been used in introduction of certain mandatory vaccination schedules. Unfortunately, as has been observed in one recent article published, mandatory vaccinations may create more problems. Like in New York City, where people are offered a choice between paying a penalty for not being vaccinated or accepting the publicly funded vaccinations, there is often a lot of distrust. This balancing act means the government must be careful in how much force it uses in ensuring people are protected from common public health hazards, such as communicable diseases, that are otherwise avoidable. This has gotten so bad in some countries that governments are doing away with the penalty system altogether and are simply telling people that they must get vaccinated. The review as published by the New Zealand researchers points out that mandatory vaccination schedules are marginally effective, but they have the contrary effect of further ostracizing populations who already lack trust in the government and, by extension, vaccines. The primary takeaway message is that even when offering alternatives such as a penalty notice or being vaccinated, many communities, and especially those who are isolated or deprived, may see no difference between the two options and attempt to forgo both. Not being vaccinated due to a lack of trust, and not paying financial penalties because there's no money to speak of. The entire situation is far more complex and not as easily addressed as simply providing more carrots and fewer sticks. Unfortunately, the complexity will not be resolved without people getting more involved. The benefit of mandatory vaccinations is worth considering when you examine it against the risk a single teenager with measles poses after visiting Disneyland, Universal Studios, and heavily transited sites such as LAX. The infected teenager flew in from New Zealand in an enclosed metal tube, prospectively exposing everybody in the aircraft to the measles virus. Then they traveled around California for 4 days. They visited most of the tourist traps. This has led to a very large number of people being exposed to the measles virus. As has been repeatedly stated, measles is one of the most contagious viruses in the world. It is estimated that up to 90% of those who have not been vaccinated and have not been exposed to the virus prior will contract the disease within 7 to 21 days of exposure. There is a 4-day lead-up and a 4-day tail after the rash appears, in which a person with the virus can still transmit it to others. This is why health officials in both Los Angeles and Orange County are trying to find anyone who might have been exposed. While not likely single-handedly responsible, it is only adding to the tally the CDC puts out every month, and 1,203 individual cases have been identified in 2019 alone. It is only superseded by the 1992 outbreak, which occurred before measles was declared eliminated in the year 2000. There is still quite a bit of time before the possible risk of either exposure or the disease showing itself expires. As an example, in 2015, a measles outbreak with 147 cases associated with it was linked to Disneyland under similar circumstances. Going on to slightly more interesting and unusual news, an extremely rare case study has been published, which has two babies who were born 11 weeks apart. This case study is interesting as it involves a pair of twins. The twins are interesting because Leah was born on May 24th and Maxim was born on August 9th, 11 weeks apart. This is in contrast to the usual minutes, maybe hours, between twins being birthed. The case study came to public attention after the Kazakh Ministry of Health put it on their social media page. One of the causes for this unusual birthing schedule is that Leah was born premature at roughly 25 weeks and, as a result, drastically underweight. Maxim appears to have been born roughly at regular timing and, as a result, weighs what a normal infant would weigh at about this age. That alone would not explain the entire story. The mother has an anatomical condition called uterus didelphys. It is a malformation that effectively creates a double uterus. This allowed each fetus to effectively undergo its own gestation in its own uterus. Fortunately, after roughly 3 months, the children are growing well and appear to be unharmed despite their unconventional birthing. In related news, the current scaremongering about caesarean sections causing autism has been shown to be bunk. The recent review found an association between caesarean section deliveries and autism by examining the compiled data of 20 million caesarean and vaginal deliveries in 61 observational studies going back to the 1960s. This in and of itself is an interesting outcome to find, but it lacks foundational evidence other than a correlation. And, as most people know, correlation does not equal causation. The review found an approximately 1.33 times greater risk of being diagnosed with a form of autism when delivered by caesarean section. That is a roughly 3.2% chance versus a 2.7% chance from observational data. That is on the high end. On the lower end, you might find that it's a base risk of 0.6%. That risk then rises to 0.8%. Based on this and the wide variability in both the data sources and the possible sample populations, the findings are, again, interesting, but need to be taken with salt. They also found association with other neurodevelopmental disorders. Considering the other contentious findings around caesarean delivery, this has created something of a powder keg, with the topic being almost too explosive to touch. In contrast, there is this study into gluten sensitivity, your health, and whether or not consumption may not be good for you. Rather obviously, if you have celiac disease, gluten will have an adverse effect on you. Varying degrees of adverse, but adverse nonetheless. In comparison to this, you have people who claim to be gluten sensitive. Gluten sensitive is not a diagnosis, and this study has found that consuming gluten will not have an effect on you in any adverse way. The grounds upon which this research are based are the mass consumption of gluten-free products by those who do not have celiac disease. The market share for this has increased accordingly, and although great for those with celiacs who need special dietary products, the consumption is based on the false premise that gluten-free food is healthier. As with other conditions, it is often not necessarily the diet alone that is healthy, but the people who are practicing it and being more mindful of what they consume and how they behave. Despite that, 65% of the public still think gluten-free diets are healthier. As with other studies covered in the past, the process used a dietary supplement given to either the control or experimental group. In this case, it involved 28 volunteers who consumed their food over 2 weeks. Each received either 14 grams of gluten or a non-gluten substitute. Neither the participants nor the researchers were aware of who was receiving what supplement. They then reported on their condition both before and after the experiment, bearing in mind that all 28 volunteers were supposed to be entirely healthy. Analysis of both the control and experimental group showed there was no significant difference between the volunteers in any of the symptoms. The findings do not fundamentally undermine those with celiac disease or similar diagnosable gluten issues. It only points out that for those who are healthy and without any need for the gluten-free diet who are taking it, there is no benefit. Returning to pharmaceutical companies for a short time, in a landmark case, a pharmaceutical manufacturer has been blamed for the opioid crisis. A judge has found Johnson & Johnson is responsible for Oklahoma's opioid issues and ordered the pharmaceutical company to pay $572 million to resolve the devastation caused by this. The county district judge's decision is the first to make a drug manufacturer accountable for the fallout. This decision is likely to be appealed, but it is tied into the more than 400,000 deaths directly associated with painkiller use, heroin use, and illegal fentanyl. The over $500 million decision is only a drop in the bucket compared to what the state was originally seeking, where they had asked for $17.5 billion over 30 years for the treatment and care of those who would be affected by it due to addiction and other related events. The decision is likely to fuel the fire in other states for their own lawmakers or state's attorney to seek similar judgments under their own state, if not federal law. At least in Oklahoma, a large part of the case stems from the fact that Johnson & Johnson and 2 of its subsidiaries are responsible for the manufacturing and supply of approximately 60% of the state's opioids. These may also be supplied to other companies for their own production and distribution. Johnson & Johnson argued during the case that they could not be held accountable for following state and federal law, legally supplying the drug, and providing it to other legal suppliers, but that it fell on doctors who should have known what they were prescribing and how often to control how much access their patients had to the pain relief agent in the form of opioids. These 2 opposing views would not normally have been able to meet. Oklahoma is at least a little bit unique in that they have taken a very novel approach, using their nuisance laws that normally allowed for those who produce loud noise, run brothels, or pollute to be taken to court, as it would harm others or their property. Oklahoma's representative in the court has argued that simply by supplying opioids to manufacturers and making them available for prescription, Johnson & Johnson has created an act that could endanger the local residents of Oklahoma and therefore fell under the nuisance laws. The appeal has some merit on both sides. At least one Oklahoman law professor has said the interpretation could pass under legal scrutiny. However, a judge in North Dakota threw out a case trying a similar line of reasoning when used against Purdue, in what could perhaps be seen as a longer-running prospective health issue. Metal particles from tattooed needles have been found in human lymph nodes. There has been some evidence for quite a while that at least some of the dye from tattoos can find its way into immune cells and then the lymph nodes. Normally, the dye used in these tattoos is simply too large and too cumbersome to get access to by the immune cells. This is why it is normally found in very limited quantities. However, investigation into some of these cases has found metal nanoparticles, and in particular nickel and chromium, can make their way to the lymph node. Fundamentally, what the researchers have found is that the needle wears down physically, and that this wear and tear removes particles from the needle itself, and these in turn are what travel to the lymph node. Unfortunately, this is very novel in its findings and proof, and as a result, it is as yet unknown what health effects it might have in the long term, and as such, further research is required. Finally, in a piece of weird and unusual news, a massive volcanic rock raft is slowly but surely traveling towards Australia, and somehow this is good news. Before the flat earthers get in, yes, Australia is real, and it is not a story made up to cover genocide by the British. This giant rock formation appeared in the Pacific Ocean on August 9th. It appears to have been produced by an underwater volcano and created pumice that is over 20,000 football fields in size. Pumice is a very light rock and as a result floats on the ocean's surface. The material it is made up varies between the size of ping pong balls to those of soccer balls. The reason this giant floating water hazard is good news for Australia is it may help the global warming stricken Great Barrier Reef. This is based on past evidence from similar events that have occurred in the last 20 years. What has been found is that these giant pumice rafts bring with them healthy new coral and reef life that can help to either repopulate or reinvigorate the Great Barrier Reef. This is seconded by its timing. It appears like it is going to pass through New Caledonia and Vanuatu around the same time as the coral goes through its spawning period. This could create a traveling biome full of new seed for the Great Barrier Reef. By the time it arrives on the Great Barrier Reef, it should be teeming with these new life forms. Thank you for watching this video. If you have found it interesting or useful, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.